I'd like to ask the Minister for Health and Social Care when the new Chief Executive Officer for Health and Social Care will be relocating to the island, and also what type of contract the CEO will be contracted for the department.
Calling the Minister to reply, Mr Ashford.
Thank you, Mr President. The new interim Chief Executive will not be relocating her family to the island, but will commute weekly. In terms of the contract, the new interim Chief Executive is to be appointed on secondment from her current role as Chief Executive at NHS Herts Valley Clinical Commissioning Group, with effect from the 1st of January 2020 on a 2-year contract.
Supplementary, Ms Ayres.
Thank you, Mr President. Obviously, from the initial statement that was released about the new appointment, it did change to a secondment within a short space of time. Who are we seconding? Are we seconding the individual, or are we seconding the Hearts Trust?
Minister.
Thank you, Mr President. It's the individual. This comment is between the PSC and her current employer. She will be working full-time for the Department of Health and Social Care here as Chief Executive of the department.
Mr Speaker.
Given that this is not a standard civil service contract, can the Minister assure people that the post holder will be subject to regular Manx income tax, and whether the role will be superannuated or not?
Reply, sir.
Thank you, Mr President. My understanding is that that is the case, but if it is any different, then I will obviously write to honourable members. But my understanding is that that is most definitely the case, that it will be subject to Manx income tax and superannuation as well. But like I say, should that turn out to be any different, I will write to the Honourable Court. One of the things I do want to say, Mr President, is I think we have got an absolutely excellent candidate for the role. I think she will be absolutely amazing in it, and I look forward to working with her from January onwards for 2 years.
Final supplementary, Ms Edge.
Thank you, Mr President. The Minister is quite clear that the new post holder will be commuting weekly. What is the situation? Obviously, our healthcare is 24/7. What will be the situation at weekends, etc.? Has the Minister considered this? And is he confirming that the post holder will definitely be on site within the department 5 days a week?
Thank you, Mr President. No, I'm not. I'm actually saying that the interim Chief Executive, she will be commuting. She will spend a minimum of 3 days on Ireland, but she will be working for us full-time. One of the things I've got to say, Mr President, is we are living in 2019, not 1919. People do work and can work remotely. With playing devil's advocate and throwing a grenade out there now, I think actually that flexible working is something we should do more of across the whole of government. And actually she will still be working full-time. I think that if you have to have a Chief Executive physically here, physically present, sat in an office 5 days a week, then I think there's something fundamentally wrong if they have to micromanage to that extent the department, and there's something wrong with the rest of our senior management team.